I'm David Mason, the Director of Public Health for the town of Sandwich, and we are here for PSA for year 3, PSA number 1, and we're here with Chief Burke, and we'll start off as we have in the past with where the town is at with case numbers.
All right, thank you, Dave. Welcome back, I guess, is the...
Is it truly a welcome?
Not really, but here we are. So to update folks, what it looks like in the town right now, 246 cases, active cases, which obviously is an all-time high. The hospital update is 65 people hospitalized at Cape Cod and Falmouth, 40 at Cape Cod, 25 at Falmouth, 6 in the ICU. So that 65 number is in line with about a year ago when we hit our peak. The 246 is well above what our peak was last year. Updates in terms of numbers for public safety, we currently have 8 personnel out at the fire department, COVID positive, 7 were vaccinated. We're expecting a few of them back this week, but we're still able to handle the day-to-day calls. We haven't hit our staffing level. We have 15 people out. That trips a different staffing level, so we have not hit that yet. About 80% of our call volume now is COVID positive patients, either from homes or from medical centers. So again, we're pretty much where we were last year in terms of dealing with the peak. The only change is with this particular strain, it is very contagious, as we're finding out. So, you know, the 8 people that are out positive were all on cardiac arrest calls. And they all started popping positive about 48 hours after that over the Christmas holiday. So again, we're taking all the measures we can with the vaccines and personal protective equipment, but it still made its way through. So we're riding it out right now. I know the police department has a few people out, but I think the good news is the severity of illness that we saw back in year 1 and partly with Delta in year 2 is moderate. At this point, it is not, we're not seeing people out for extended periods of time. Though this virus is individual, I have 2 vaccinated personnel that are going to be out at least 3 weeks with significant respiratory issues from this particular strain. But again, we had planned for this. We have plans in place for this. We're in year 3. We continue to test our employees before they come in the building, and we'll make it through hopefully the next 4 weeks or so and get on the other side.
Super. Let's back up a little, Chief. On our COVID team, and we met this morning, we've still been meeting, we have Dr. Bemis, who is a resident in town here and provides information for the team relative to hospitalization. And, you know, because we're still getting questions from people, it's, you know, I hear it's, you know, the vaccinated people that are in the hospital and whatnot. And he provides us with statistics and on a regular basis. Can you just speak to that as far as his recent update also? Yeah,
so he was working yesterday. I talked to him last night. He said he's never seen the ER so full. Especially at Falmouth. He usually works out of Falmouth and at Stoneman. And what they're seeing is about half of it is COVID patients. A lot of it is people looking for COVID tests. But those that are hospitalized, about 75% are unvaccinated is what he's seeing. Now, it doesn't preclude you, if you're vaccinated, from having to be hospitalized. There's a lot of factors, underlying conditions, et cetera. But 75% of what he's seeing admitted in the hospitals are unvaccinated. Those that have both shots and a booster, he's basically seeing as very mild illness at this point. So that's where he's at. He's been a good source of intelligence of what he's seeing both at Stoneman and in the ER, and this is where they're at right now. It's a significant impact and surge. I would say it's worse in the hospitals now than it was last year, but again, we have a more contagious virus. So again, hopefully if we follow the South African model, which I have to preface by saying they're in their summer season right now, but with the significant steep incline and significant drop we're seeing there, we're hopeful that we will follow the same pattern. Kind of similar to last year, though, it was stretched out a little longer, but if you remember by February, we were seeing the numbers decline pretty significantly, so hopefully we're going to be in the same boat again coming up in the next couple weeks.
The other subject, Chief, because we spoke to this morning too, is when the people in your department respond to calls and respond to emergency calls. You've had a couple situations of COVID positive because of situations. Do you want to speak to that?
Yep.
And at the same time, you know, if for people in town, when they're calling the rescue or the police, what do you suggest for them?
Yeah, so if you're going to call 911, the dispatcher is going to ask you some questions. They're going to ask if there's illness in the household. They're going to ask if there's a COVID positive person. We treat everybody like they have COVID. Even if you have back pain, we're going to treat you basically the same, just to be on the cautious side. But you will get some questioning, and then that questions will be reaffirmed when the ambulance crew gets there. They're going to ask the same thing again. One person may enter the house. You may not see the whole crew necessarily coming in. That goes back to our year one protocols, where we had one person interacting and then making the determination as to what was needed. So you'll probably see, on some cases, you will see that, and that's just, again, reflective of the policies that we put in place since 2020. Cases that we've seen, and what we've seen in the virus, things have ebbed and flowed. It's been pretty interesting. Initially, the first year, we saw cardiac arrests were significantly up. Then things transitioned to stroke-like symptoms during Delta. Late fall, it was UTI-like symptoms and falls. And now we're back to cardiac arrests. I think we've had 3 significant ones in the last 10 days, 2 during Christmas week that were COVID positive people. So we're starting to see that return. But just be prepared. If you are going to call 911, we are going to ask some questions. We are going to have personal protective equipment on as we enter. And there may be one person that enters your residence initially. And that's just to find out what's going on, make determinations as to what equipment is needed and the best way to care for your loved one. If they need to be transported, we will transport them to the hospital.
No, so I appreciate that, because I think it's important to know, what's in place and why, because we're trying to protect your people in order to protect the town and be able to respond to them also. And you mentioned as far as the what we're seeing for symptoms, and Joanne had spoken to, because when we're calling people for contact tracing, which we're still doing, and I'll talk about that a little later, but in terms of, Joanne had mentioned in the over 60 population that they're seeing more GI issues. You want to speak to that?
Yep, so the 60 plus, 55, 60 plus population, nausea, vomiting, and aches, which again can be symptomatic of the flu also, so we have that running around. The 30 to 45, 50 population, more respiratory driven. Again, with the coughing and the aches and fevers are hit or miss. It's pretty interesting. Some people have them, some people don't. That's not a precursor like it was before, where if you had a fever, we're like, yeah, you probably have it. And then the pediatric population, we're seeing an uptick again, like a bad cold.
Or the sore throat.
Sore throat.
Headache. But again, you're right, as far as the fever isn't what, isn't
What it used to be.
seen what it used to be, yeah.
Yep.
So, and as we're proceeding on too, we'll have Chief update us. We've had a very active testing program that Chief has been running through the department. And for local businesses, he scored on that, and he can speak to that as far as what's happening with testing.
Yep, so I have to give credit to Senator Susan Moran, who's our Senate rep here for the region. She was able to secure $10,000 for testing supplies for our businesses. So as you remember in May when we were here, we announced the BEAT COVID initiative, which BEAT stands for Business Employment Assistance Testing. We've had businesses take advantage of that since May with their employees. We're pivoting now to a more individual test strategy, meaning the individual test kits, the home kits that you see. We're targeting this $10,000 earmark supported by Senator Moran and Rep. Steve Zaros to target for our businesses in town to keep them moving. So we're hopeful in the next 30 days we'll be able to secure those testing kits and start a distribution program through the Chamber of Commerce for those business leaders in town. It's always been about keeping the town open and moving forward. We were able to get through the summer, and we want to equip our businesses now, instead of them having to send employees to us, that testing can be done by the individual employee at home under the direction of the business leader or the director of the business. And I think that's going to be a big step in the right direction. And again, I want to thank legislative delegation for that, for putting that out there, for giving us the ability to take care of that segment of the population. The municipal testing program has continued for the last 2 years, basically. We have not changed. We did hit a lull here and there, but we're able to identify town employees when they are symptomatic, that we can keep them out of work but keep the building open. And I think that is the key to this, is as soon as they're symptomatic, we can test. We can do the immediate internal contact tracing, but we have not had to close town buildings. We're able to get out in front of a lot of these potential infections, but keep things open for the public. So if the public needs to do business in a town building, they can do it.
Since June of 2020.
Since June of 2020.
Yep.
So we're
Compared
coming
to
up-
most other municipalities and state agencies.
Yep.
So we've been doing pretty well with that program that you've been offering, and it's been readily accessible too. So it's been successful. So that's a big thank to the chief and his department for having that operating. As far as where we stand now too relative to vaccinations, I know that Joanne had offered the public health nurse, Joanne Gake, had offered boosters, in which we probably did a little over 1,000 individuals. We've been holding on that. I know that the county Barnstable County Health is looking to ramp up their vaccination again. They've been holding on it, but there should be some announcements coming out on that, and for testing, because I know testing for the public has not been readily available. I know home testing kits are not readily available. We do have a lot of people calling. I'm sure Chief has gotten the calls. I have, Joanne, and it's just a matter, you really just have to be diligent about doing your research and finding who has what available. You know, the information that is available changes every 10 minutes, really, in terms of where you can get tests and when. So you really have to keep track of that yourself, because the information is changing for us quickly. The other issue is, as far as when you do receive a test of positive, please reach out to your physician. Many people are just getting tested. I'm positive and I'm just going to hang in there and go it on my own. Reach out to your physician, and because there is the chance of being connected for a script for monoclonal antibodies for a treatment at that point in time, which people are finding beneficial also. So have that discussion with your physician. Don't just let it ride, figuring you're going to just ride it out like the flu, because with everybody, and Chief mentioned this, it changes with everyone. And it's different with everybody from person to person at that point also.
Dave, can I mention something on the home test? When you test positive, Dave mentioned the notification of your primary care. The other thing is, and things change, but if you are COVID positive, the quarantine rules change for you once you're out of your COVID positive time frame. So I believe it was 90 days where if you were exposed to a COVID positive person, you did not have to quarantine because you were positive. So there is, I know people have hesitancy in reporting positives, but there are some benefits there to that. And again, I think we mentioned this morning, I think the majority of people with a home test will take it, see they're positive, mask up, not say anything, go about their business, but be careful, which again is a positive thing, but making sure at a minimum your primary care physician is notified of that, because you also don't know any symptoms that come on later that we want to make sure that is tracked. And so at a minimum, if you can notify your PCP, I think that's
to create a baseline, just in case something does go on, like you've seen with heart attack issues, so there's an understanding of what's occurring. At that point. And Chief spoke to the protocol. So the state did issue new protocols relative to isolation and quarantine. So, you know, and many of this is just common sense, you know, because the CDC is published and is based on our follow-up with people that found that the transmissivity of the virus is 2 days before symptoms and then 3 days after. And hence the CDC and the state going to a protocol of, if you're positive, you sit at home for 5 days, and at day 5, if you're feeling better and your symptoms are not worsening and you don't have a fever, you can then go into the public wearing a mask. So it's, it's a lot of just common sense in order to be respectful of people around you. So you're, instead of the 10 days, you're at the 5 days when, and then a mask for the additional 5 days after that. So, and it does vary also with those who are vaccinated, but it's pretty much the same premise at that point. So it's just, just be smart and be considerate of the people around you. So do we have anything else, Chief?
Nope, I think we'll probably keep the updates coming, maybe every 2 weeks for the next couple weeks as things unfold. Just know we're trying our best. Again, not that we don't like talking to you, but we really don't want to be in front of you if we don't have to be. But we felt with the uptick in the start of the new year, it was important to get some information out there. But just know your public safety folks are working diligently. We're going to make it through. I think we're going to get to the other side and hopefully get some normalcy back here again as we approach year 3. We have the resources and policies in place to try to keep the town moving forward. That's been my goal from day one, is do not go backwards. Keep pushing forward.
And keep thinking of going backwards. I apologize for this, but as far as we do get a lot of email requests and calls regarding as far as, what mandates we're going to put in place. And so I think we should address that as far as, and in progress of this, we are following the state's guidelines. And at this point, they do recommend masking indoors. And, but we are not looking at, as a town, I know some towns are looking at vaccination mandates for entry or masking mandates. We're not discussing that. That's not on the table because I think, in my opinion, a mishmash approach of towns having various approaches is not cohesive and does not solve anything. I mean, if there is a need for a bigger approach, that should come from the state as one overall umbrella guideline for everyone at this point. By example, I have said to people that at one time the Board of Health was being asked to consider putting in place the prohibiting the sale of tobacco, cigarettes, to people under the age of, to moving the age to 21. And, okay, so the town of Sandwich could have an age 21 limit, but if no other town does it, they're just going to go to those other towns and buy cigarettes. The same is true with this virus. If it's a mishmash, you're going to still have transfer because not everybody stays within the bounds of Sandwich. Does that make sense?
It does, and I think in my research, we look at it, I think we need to be careful about the term vaccine. You made a good point about this is a pre-COVID therapeutic.
Yeah, right.
As soon as breakthrough cases occurred, I think we pivot from the vaccine was not going to prevent you from getting it. And I think that messaging needs to shift. And when you attach mandates of vaccinations to I think you could do that if there was no transmission and or you were not going to get the virus. But the fact that the breakthrough cases are more than are documented out there now, I think mandates defeat the purpose. And I think people at this point take on their own responsibility. If they want to wear a mask, go ahead.
Right.
I think that's more than appropriate. I'm not going to besmirch anybody from wearing a mask. I think if you're vaccinated and at this point, I think if there's no mask mandate, I think it's an advisory. That's what it is. Advise yourself. And you may wear it, you may not, that's up to you. But again, I emphasize this, we cannot go backwards. The hardest part leading from the front is keep pushing. And people want to go back. They want, should we lock down? Should we do this? No. The whole point is we need to move this needle forward. It's sometimes painful, but I think we're going to see, we get the next 4 to 6 weeks and we get over this initial hump. I think the goal has always been to make the citizens safe, but also take care of our businesses locally. A lot of revenue is driven from our businesses, especially in the summer season. Let's set them up for success again. And that's where I sit, and that's some personal commentary there, but that's where I've sat from the beginning on this, is move forward, continue to move forward, learn to adapt, and learn to to live, and I think we'll be in a better place.
Well, I think that's what the new protocols are also, because as far as, really in some ways like the contact tracing, I spoke to this morning, it's an antiquated process that's not working for the situation as it was intended. And so we need to adapt to that. And I think that the CDC's move to the 5 days, 5 days, 5 is a move in that direction. It's adapting to the knowledge that we have now of the virus, so.
Yep, I think we've done a good job, and we continue to be open-minded for the adaptation of what needs to come. You can't stay stagnant in one area, and we've tried to stay ahead of things moving forward. And I think just letting people know that our team still meets once a week. It's been 2 years, whatever, but we're still meeting, discussing, looking at changes, looking at the adaptations that need to happen. And we're already looking at what's the 90-day out plan. I've always said that. We look 90 days out from today, April 4th, where we're going to be. What are things going to look like? Let's make sure that we're planning ahead for that. So keep our fingers crossed. Again, we'll keep you updated the next month or two, and then we'll go from there.
So we will say it's going to be a tough month numbers-wise, but we will see the decline in about 4 weeks as far as the direction it's going. And with that, we will be talking to you soon. So thank you very much. Stay safe out there and be respectful of others. Thank you.
Thank you.